Surgery, and then the healing is a process. So you're signing up for the whole process.
So I decided to book my consultation, and I was 100% happy when I came out because Dr. Salman was really honest.
So I have colleagues who are excellent surgeons who've just chosen not to do revision rhinoplasty because it's something they don't want to have as part of their practice. But that being said, some of the patients that get revision rhinoplasty are the most thrilled, happy patients we see.
Liquid rhinoplasty should be only done by the surgeon.
And then I tell people it's roughly about 1 in 10 chance you may require a touch-up.
And sorry, how old were you when you had it done? You were 16?
16.
And at 16, did you have your parents with you?
Yeah, I was like with my parents.
Okay, because that's something that we require as well.
Dr. Salman, I love my nose. It looks amazing.
I'm so happy for you, and that's what makes this job worthwhile. Hey guys, it's Dr. Solomon again at our podcast called UnPhiltered. Today we have 2 new faces on the podcast. We have Maya, who's someone that you probably have spoken to at our clinic. She's one of our lead administrators who's involved with our client interface and is super helpful to arrange surgery for patients and take you through your surgical journey. And we also have a guest today, Claudia, who's visiting us. She was nice enough to participate and to tell her story through revision rhinoplasty. So we're going to go a little bit casual back and forth. Maya's going to be here to ask some questions. I'm going to ask some questions of Claudia, and we'll hopefully cover the topic of revision rhinoplasty, debulk it, demystify it, and give you sort of the surgeon's, or my at least, perspective on that operation. Mm-hmm. So, Claudia, why don't you introduce yourself, tell the audience a little bit about yourself, and a little bit about I guess, where you started with your first rhinoplasty.
Well, I'm originally from Lima, Peru. I'm 32 years old. I work for a mining and construction company. And on my free time, I love to do some digital content, mostly photo shoots. I decided to do my revision rhinoplasty because I wasn't 100% happy with my first surgery.
And when did you have your first surgery?
I had it when I was 16 years old.
Okay.
And I think I was too young at that time to know exactly what I wanted, and I just wanted to correct some minor issues. Obviously, I wasn't happy with how my natural nose looked like. What we did was correct some stuff from the bridge and reshape it a little bit. So as years pass, and obviously I'm like 32 and it's been a long time, I wanted to be really sure of how I wanted my nose to look like. By taking a lot of pictures, I noticed the things I didn't like. But I didn't want to be one patient that goes to multiple rhinoplasties. And so I want to be 100% sure how I want it to look like. And also have someone to be honest and tell me what was possible to be done with my nose.
Did you go back to your original surgeon?
No, I did not, because I live here permanently. So I didn't want to travel and do all the recovery back home and then come back here. It was just too much. I just want to be in peace at home.
Yeah. So what made you decide to go to Dr. Solomon?
Well, I actually did my research. It really took a long time.
Which is very important.
Yeah. And I wanted a surgeon that was specialized in facial cosmetic surgery. And I was so happy when I found Dr. Solomon. I was really impacted with like the beautiful work he does in his patients. The pictures on the website were amazing. Also, I did like some investigation in TikTok to see the reviews, and it was like one of the patients that looked really good. But obviously, it was her first rhinoplasty, and I am revision. So I went to Google reviews, and there was the picture of this patient named Amy, and I really like how her revision rhinoplasty turned out. So I decided to book my consultation, and I was 100% happy when I came out because Dr. Salman was really honest.
Yes.
And I wasn't even aware that I have thick skin, which means that there's not much that can be done sometimes, and it's more like, I think, an illusion.
Yes.
To like get what I wanted, and that's what I liked. It was like honest, it was professional, and when he showed me how I was gonna look, I really like it.
Well, you touched on a good point because primary rhinoplasty and revision rhinoplasty is different when it comes to the anatomy of the nose. So looking at a picture doesn't necessarily mean you're going to achieve the same nose. So that's why a surgeon that specializes in revision rhinoplasty is also beneficial for the patient.
Yeah, no, for sure. It's a whole huge topic, which we're going to touch on today. But when we see patients wanting revisions, step one is to identify what is wrong with the nose, if anything, and then what can be done to improve upon it, and then whether that's practically achievable with surgical intervention, because there's always, limitations as to what we can do. So when you saw me, your main goal, I think, related to, well, you can tell us, you had sort of one or two main things you were hoping to change.
I just didn't like this part over here, the nasal folds, I think is.
Yeah,
I wanted like smaller,
base.
and this part over here, I wanted a little bit more refined. I just didn't like how it looked before. And I think you told me that my bridge was okay because I think I have an implant inside, so you didn't want to touch that, which I think it was like a really good choice because I think I could have an infection maybe if you touch that part.
Right. So each case that we see has got its own sort of individual issues. Some people have had more than one operation. Some people have had surgical implants done. Some people have had cartilage grafting, rib cartilage grafting. So all of those have to be taken into consideration. And then some people also have had injuries. So all those factors we don't necessarily know going in. We try our best to have all the info, but I remember when I was training, surgeons used to, who were rhinoplasty experts, would want to have the surgical notes of the prior surgeon. And then one of the most sort of esteemed professors that I learned from said he didn't really rely on them because they didn't necessarily give him that much more information when he went in. And really, you were sort of opening up and had a plan and had to see what could be done during the procedure. So you have to have sort of a bunch of be open-minded as to what you're going to encounter during the operation and have a plan, but you have to have some flexibility to make sure you can achieve what you want. So we decided to do a revision, but we also talked about adding some cartilage to your nasal tip, and we have a few options for that, either your own cartilage or cadaver cartilage. And when we're using your own cartilage, it's either the septum, second would be ear cartilage, and third would be your own rib. All of those obviously require, harvesting the tissue. So some people don't want to have a cut on their chest wall or have part of their ear removed. So we now have cadaver cartilage grafting, which in the old days was not necessarily a great option because the grafts from cadavers were put through a different process and didn't seem to sort of have longevity and hold up. But the newer cadaver grafts seem really, really good. And most surgeons who use them find them very comparable to people's own ribs, and in some cases even better than someone's own rib because they're harvested from unfortunate younger patients. So they're actually not calcified and hardened, which can happen with your own rib once you pass about 45 years of age. So we decided to use a cadaver graft. We bring these in from the United States from one particular lab that we work with a lot, and we put it through, they put it through a sterilization process to make sure you don't get an infection and things like that. And we used just a small graft to lift the nasal tip. So we did what's called a septal extension graft, which means we created a new front part of the septum, and that allowed us sort of a structure, like a beam to sew the tip onto to allow us to elevate the tip and to hold it in a new position and to give it some nice structure that'll last the rest of your life. So that was the surgical plan and the goal. And I think we were able to achieve it. So far, so good. I mean, you look happy and smiling. Yeah. So that's always the best indicator of a successful outcome. And you're now how many months out?
3 months.
3 months.
3 months. So she's, you're looking terrific. And the fact you're happy is sort of a testament that it was worth doing the procedure. And we're going to keep an eye on it for about 12 months just to make sure that everything heals. But I think you're past all the tricky stuff. You should be hopefully smooth roads ahead, and it'll probably not change too much from now to the end of the year, but we'll keep an eye on things.
Now, is there any advice for people that are watching this that are considering a revision rhinoplasty that you would give to a person or even a friend or someone that you meet while they're considering it? Sorry.
No. I will definitely advise people that are like thinking about getting a revision rhinoplasty to really do the research and find a good surgeon that's going to be honest, and it's not going to be like, oh yeah, we can do that nose, and maybe it does not look natural and looks maybe a little too fake, and then you have to go more times to get another revision, and which is not good, because I think it's more work.
Yes. And I think you're limited to how many revisions you can do, or is that a myth, or am I wrong?
I think the more surgeries you have, obviously the risk profile goes up, and a lot of it relates to damaging the overlying skin. So if you keep on opening the nose and closing the nose, the skin may start undergoing some scarification and some changes. So you want to hopefully avoid major revisions. Sometimes more minor revisions, like smoothing over a little bit of an edge on the bone or making minor adjustments, can be done. Some cases, unfortunately, it's the nature of rhinoplasty. If you're seeing a surgeon or you're embarking on the journey of a rhinoplasty, you have to be educated that there is a possibility you may require more than one operation to meet your surgical goals. And we can get it. We have a bunch of questions I think you're going to go through, but I'll touch on all those now.
Yeah, so the main question is, what factors will indicate, or do you consider doing a revision rhinoplasty when someone comes in, like the duration, or what are those factors that you're looking for that you would consider a good candidate to have a revision rhinoplasty?
Yeah, so, I think of revisions as two categories. I think of revisions of my own work, where I've done a primary rhinoplasty and myself or the patient feel that we can improve upon it, or something didn't heal as well as we hoped. Yeah. Or maybe the nose still has an asymmetry, or the tip's not exactly the same side to side. And in those cases, I've done the primary. I'm sort of committed as part of the process to do another procedure, but we have to wait 12 months before that can happen. And I tell people it's roughly about 1 in 10 chance you may require a touch-up. Okay. And then 1 in 10 of those may require a third touch-up. So it's like 10% of 10%. So it's about close to 1 to 2% that you'd require more surgeries. Yeah. But I think it does vary among surgeons. And unfortunately, surgeons don't always know of their own work who's required a revision. Like your surgeon in Peru has no idea that you required a revision years later. So when people are looking at their own stats, it's a little bit of a myth or artificial statistics, because we don't know. Patients may have left us and gone to another surgeon, myself included. But that's one consideration. The other factors that determine the other type of category of revision is revising someone else's work. Yes. And that can occur in two circumstances, I guess. One is that the first surgeon doesn't feel comfortable necessarily doing another operation for whatever reason. Maybe the operation is something they're not familiar with, or they don't do a lot of revisions. Yeah. Or maybe the complexity of the case is more complex than was originally anticipated. Yeah. So that does occur.
Yeah. So expertise, obviously, and having over 20 years experience definitely makes it easier for you to kind of look at something that somebody else has done, correct me if I'm wrong, and then be able to.
Yeah, I think experience and expertise certainly plays a part of it. I think some surgeons don't want to do revision rhinoplasty. It comes with a whole myriad of complexities in terms of the patient factor. They may be stressed out from the first operation. The goals that you're trying to achieve may be less predictable. It could be emotional for the patient. Mm-hmm. So I have colleagues who are excellent surgeons who've just chosen not to do revision rhinoplasty because it's something they don't want to have as part of their practice. Yes. But that being said, some of the patients that get revision rhinoplasty are the most thrilled, happy patients we see. Mm-hmm. So I think patient selection is obviously important. I think if you have experience and you've done revision rhinoplasty as part of your practice and you've cultivated an expertise in doing so, then I think it's a great operation to provide access to, because we see patients who are sort of given up, or they've gone around a little bit of we call them patients who are put into orbit. They're sort of swirling around trying to find a surgeon to take on their care. Yeah. There are some cases that are extremely complicated, that the nose is, just gone awry. Something unfortunate has happened. Usually those circumstances.
Is healing an indication or a factor that plays into having a revision rhinoplasty? The way the patient healed?
Yeah, the way the patient heals for sure, part of it. If a patient's had a complex history, meaning like they've had trauma, for instance, when they're younger, their nose may be crooked no matter what the surgeon does, and he's fighting against a crooked structure. Then they've gone and had rhinoplasty. In the old days, rhinoplasties were done in a relatively aggressive manner where a lot of tissue was often removed.
Yes.
And those were called reductive procedures. But the structure that was left behind may be more fragile and weak and may be more prone to curvature or twisting or collapse over time.
Yeah. Mm-hmm.
And then the pendulum swung to create stronger noses where they were it was known as structured rhinoplasty, where we would remove tissue in one part of the nose and then rebuild and structure the nose in another part of the nose. And that was a great sort of change in the rhinoplasty paradigm, the way we perceived how we do the actual operation.
Mm-hmm.
But then some noses became larger and too structured, and especially in female patients, they may have felt that the nose looked too big.
Mm-hmm.
And then more recently, there's an operation called preservation rhinoplasty, which is another attempt to maintain natural rhinoplasty results and reduce the chance of needing a revision. And that operation is you're actually dropping the nose closer to the face.
Okay.
Rather than removing the bump of the nose, you're removing more tissue in the undersurface of the nose and dropping it down. And surgeons who've invested energy in sort of becoming experts in preservation rhinoplasty feel that operation may carry a lower revision rate. But it's got its own complexity to it. It's got its own issues and things like that, just like everything else. Yeah. Nothing's perfect. So there are sort of 3 or 4 categories of nose jobs that you can undergo, making it even harder for patients to decide on. But I think the general idea is that revision rhinoplasty, we obviously try our best to avoid it. Mm-hmm. But in some circumstances, I feel strongly that a surgeon who's offering a primary rhinoplasty should at least have the core competencies to at least address issues with their own patients. And in rare circumstances, if they're not comfortable addressing it, feel comfortable referring to another colleague who they work with, collaborate with, to at least help the patient get to where they want to go.
So if a patient doesn't want to go the surgical route anymore for the issues that you touched upon, emotional, doesn't want to go through surgery again, etc., what other options are there for a patient?
Yeah, it's a great question. And sometimes patients who present with more minor issues with their nose after rhinoplasty, little things can be done to address them that are non-surgical, the most common being filler.
Yes.
So injectable filler can be done for what's known as liquid rhinoplasty or injection rhinoplasty. Mm-hmm. And it's sort of a camouflaging agent. So it's great for dealing with very subtle imperfections of the nasal bridge, like a tiny dent that forms or a tiny bit of a dip that you feel may be excessive, can be just corrected in the office setting. It's got some limitations, but it's certainly added to our toolbox of things that we can offer patients. So we do occasionally put a little droplet of filler in a nose to improve its nasal bridge, and sometimes we use it as a camouflaging agent on the nasal tip as well.
Yeah. And I know from obviously working with you that liquid rhinoplasty should be only done by the surgeon.
Yeah, in our clinic, we have nurse injectors and myself. In our clinic, I'm the one who does the liquid rhinoplasty or injection rhinoplasty, just because it comes with its own sort of risk profile.
Yeah.
There are some nurses out there who do injection rhinoplasty and are trained and comfortable with it. In our facility, because I do rhinoplasty surgery, I typically like to be the one doing the nose injections.
In some patients that come to us, we do cortisone shots. So give it a little explanation of why cortisone shots are beneficial for the patient.
Sure. So when we're doing rhinoplasty, we're working primarily on the bone and cartilage. We're not doing a lot to the skin. We sometimes defat the skin from the undersurface a little bit to create some definition, but certain patients have thicker skin, and we can't really change that surgically. Like we can't really scrape and thin out the skin, or you may damage it. So use of cortisone or another injectable product known as 5-FU, which has been proven to help scars, can be injected into the rhinoplasty post-surgically to help with swelling, inflammation, and reduce potential scar tissue forming around, especially the lower third of the nose and nasal tip, and can slim it out a little bit. One other thing that we've started doing more frequently in the last 5 years is use of Accutane, which is an oral treatment for acne. But many patients who are on Accutane found that their nose job results changed and in many cases slimmed out the nose. So we sometimes see patients who have thick skin, undergo rhinoplasty. We counsel them preoperatively. It may not be as refined or thin as you dream of, but keep an open mind. Sometimes we'll inject some cortisone. Sometimes we'll have you go on a short course of Accutane, and then you're doing everything possible. You've done the bony work, the cartilage work, and now you're doing some stuff to improve the skin quality.
Mm-hmm. Now, obviously, being at the clinic every day and taking phone calls at the clinic, we do get the phone calls of patients that have done surgery overseas, Turkey being the most common one. Is it obviously more difficult to treat a patient or to do a revision rhinoplasty for someone that has done a treatment overseas?
It's, it's something we see more and more often. I mean, patients going to Tehran or to Istanbul or other parts of Turkey for surgery, and many of them come back and just want to be seen so they have postoperative care in Canada. Initially, we didn't really want to get involved in those patients' care because we weren't the primary surgeon, but we sometimes see patients in the office just for cortisone shots to collaborate with their surgeon overseas. If they send us a note saying, hey, this patient came to Turkey for an operation, do you mind seeing them after and treating them with steroid shots? We're not totally closed-minded to it, and we try to help people the best we can. But if they have a problem from their surgery, it becomes more complicated because then we don't necessarily want to get involved in dealing with their acute issues. Often we're telling them to contact their surgeon who did the surgery to make sure that they get direction on how to manage their care. But it gets a little bit tricky. That's one of the pitfalls, I guess, of patients traveling abroad for surgery. I mean, we get our own patients traveling to us from the United States or other parts of Canada, but we're able to usually collaborate and deal with their family doctors who are, say they get a minor infection or a wound care issue. We're able to communicate with them on that. Yeah. I find some of the patients who've undergone surgery in Korea or in parts of Europe, it's hard to get surgical notes from them. It's hard to sort of touch base with their surgeon. Maybe there's language stuff, but they're a little bit different. They're sort of functioning often in isolation, and they seem like they're really desperate to get help locally.
It is. It's true because I know with us or at our clinic that they see you for a 6-week post-op, a 1-month post-op, a 3-month post-op, 6-month post-op, 1-year post-op. So if you're doing something overseas, it's difficult to do that and to do that follow-up care because we take pride in our follow-up care because we do photographs. You see the patient, we advise them, and we just monitor that healing. So at the 1-year mark, if a patient needs rhinoplasty, is that the time where you would recommend a rhinoplasty? How long should revision rhinoplasty?
Yeah, I mean, it's a great question, but typically we wait 12 months. So it's very rare that we want to operate on someone sooner than that for many, many just medical factors. I mean, we want the nose to be completely healed. Sometimes minor imperfections may resolve over that time period of 1 year. So you don't want to jump in and be reactive and intervene. Say someone forms a little bump after surgery and they're like, I want you to go in and touch it up. It's driving me crazy. And we're like, no, leave it because there's a small chance it could potentially just totally resolve as you go through the healing process. Because surgery is surgery, and then the healing is a process. So you're signing up for the whole process. Most of it's sort of predictable and easy, and patients have relatively predictable outcomes. But some patients we do the surgery, it looks great on the table. Then about 2 or 3 months later, swelling resolves and we start seeing little bumps and issues arising. And sometimes we want to go in and do a revision, but then we wait another 6 months, we see them back and we check the chart and we're like, oh, you had a bit of a bump and is it gone? They go, oh yeah, it totally went away. So, we don't even know ourselves, and I've been doing this 20-something years. So we really want to give your body time to heal. And then at the end of the 12 months, we do a sit down, check up, and we make sure that we're happy with everything. And then if a touch-up's required, then we talk about it at that time.
Yeah. So going back to you, Claudia, for her case, why we talked about cortisone, we talked about filler. Obviously, you assessed her. Why wasn't that something that that route she could have gone through? Why did it need to be surgical?
Right. So again, filler is a great solution for a limited indication. So if Claudia had presented and wanted to augment her nasal bridge slightly, filler could have been used. Sometimes we'll use a little droplet right in the center of the nasal tip and it may lift it a little. But in her particular case, her tip, she felt, was underprojected. It was a little flat and a little close to her face. So then you really need to add some structure, something strong, something to give her lifelong support. And that's why we needed surgery to achieve that. Filler can't achieve that. That's one of its major limitations. It can't really significantly alter the position of the nasal tip complex. So that's why we didn't offer it to you.
I know you had your surgery done in Peru. And like I said, being in South America, then I can relate as well. But a lot of our patients sometimes, like we mentioned before, that have had rhinoplasty somewhere else and come back to Dr. Solomon for a revision rhinoplasty. What are the advantages or disadvantages of that you found now based on your experience going there first and then coming here? Was there anything that stood out for you?
Oh, well, it was, I think I got it like really young, and all I remember is having a cast. And I think you no longer use a cast. I think only for some cases. But, and also I had like a closed rhinoplasty. I'm not sure if I had an open, I don't remember much, but it took me more time to heal than the second one, the revision. And I felt more at peace, I guess.
Yeah.
With the second one, it was so easy, the recovery. I wasn't much in pain. I wasn't that swollen, just a little bit bruises on my eyes. And I was comfortable at home. So yeah. I think that was like a big difference.
Oh, good. And sir, how old were you when you had it done? You were 16?
16.
And at 16, did you have your parents with you?
Yeah, I was like with my parents.
Okay, because that's something that we require as well at Dr. Solomon, is that we have anybody that is at 16 years is ours for rhinoplasty itself.
Yeah, it's our cutoff age wise for nasal development, growth, things like that. We don't operate on anyone 15, 16, sort of our youngest age group. So so as I was suggesting, when you get the nose job at a younger age at 16, it's a very different experience than having it as an adult. So emotionally, it's different in terms of the information that you're taking in and the decisions, the risks and the benefits. You're really probably giving a deep consideration in your 30s because you're more mature. You have different life perspectives. When someone's getting it at age 16, it may just seem like an easy thing. They're signing up, they're going to get a nose job, and they don't really necessarily reflect on everything surrounding it. So I think it's hard to compare because you had it done basically halfway through your life and then again now where you're at. So hopefully that we reach the point that you're satisfied with the surgical outcome, which it seems like we're there, and there's no need to touch your nose again for the next 70 or so years of your life.
Claudia, it looks amazing, obviously.
Thank you so
and
much.
obviously it's his expertise that made it look, but it looks beautiful. And I'll see you in 3 months for your 6-month post-op.
Yeah, thank you so much for having me. Thank you, Dr. Solomon. I love my nose. It looks amazing.
I'm so happy for you, and that's what makes this job worthwhile, is when patients are happy and smiling and feel that we've helped contribute to your happiness. Is awesome. So I just want to wrap up our podcast today on revision rhinoplasty. And again, thanks, Claudia, for participating. I think the information she shared hopefully is very useful for those out there who are just interested in the topic, or those seeking out revision rhinoplasty or primary rhinoplasty. The more information you can get and people's real experiences, we find super helpful for people to take into consideration before booking surgery of any kind. We're also going to move on to another topic, including the psychology and mental health as it relates to candidacy for cosmetic facial surgery.